Ever catch yourself watching those medical dramas, those intense ER scenes, and wonder just how realistic they are?
Right.
Well, today we're ditching the Hollywood drama, going for the real deal,
Yeah.
taking a deep dive into the world of trauma surgery.
And let me tell you, reality's way more intense than any TV show. We're diving into a set of, well, it's questions and answers.
Yeah.
Really meant to get surgeons ready for those high pressure, split-second calls they got to make.
Exactly. Our source today is this podcast, SurgiMind, and it is packed with insights. It really makes you appreciate the kind of thinking, the expertise that separates life and death in those moments.
Oh, absolutely.
So where do we even begin? I mean, trauma surgery, that's a whole universe.
When a patient's wheeled in, traumatic injury, the clock, it's like it starts ticking double time, Yeah. And SurgiMind, they really hit on this, those first few moments, everything.
Makes sense, but with everything happening at once, how do teams even prioritize? It seems overwhelming, frankly.
It is, you're right. Staying organized, that's key. Trauma surgeons, they use this system, it's called ABCDE, like a mental checklist, ensures they're hitting the most critical stuff first.
Okay, break that down for us. A, B, C, D, E. What's each letter mean?
So A, that's airway, making sure they can breathe. B, breathing, are the lungs working right. Then C, circulation, pulse, blood pressure, all that.
So it's about those vital functions first, then D and E, that's where disability and exposure come in, right?
You got it. Disability, that's a quick neuro check, conscious. Head injury signs. And exposure, yeah, sounds a bit rough, but it just means checking their whole body for any other injuries.
So even in that chaos, ABCDE keeps them focused. Fascinating how something so simple can be so powerful in that setting.
Totally. It shows you, in trauma, having a system, that can be the difference between, a good outcome and a bad one.
And it's not just about having the system, right? Tech's got to play a huge role too, I'd imagine.
You're spot on. SurgiMind, they talk about how tech is changing the game in trauma care. One of the big ones, ultrasound, especially something called a fast exam, using sound waves to get this sonic picture of what's going on inside.
So instead of waiting for x-rays or scans, it's almost instant information.
Exactly. And that speed, when you're dealing with internal bleeding, that can be everything.
That makes a lot of sense. Time is definitely not on your side in the ER. I am curious, though, after that initial assessment, getting them stable, what's next? What happens in that patient's journey from there?
So once they're stable, the focus shifts, right?
Yeah.
It goes from that initial assessment to actually dealing with the injuries themselves. That's where this idea of damage control surgery comes in, something SurgiMind really gets into.
Damage control surgery. Okay, that sounds kind of intense. Even for the ER, what's that all about?
It's interesting, actually. See, it challenges the old way of thinking, that you go in and fix everything perfectly right then and there in the first surgery. But imagine, say, a big car accident, multiple injuries. Damage control surgery says, hold on. Instead of immediately fixing every bone, every organ, priority one is stop the bleeding, prevent infections, stabilize them fast.
So it's like triage, but for the surgery itself.
Exactly. You're hitting those life-saving things first. SurgiMind gave this example, a ruptured spleen. Now that can cause massive bleeding, right? In the past, surgeons, they might try this complex, long repair.
I can see how that'd be super risky when the situation's already so critical.
For sure. But damage control says, nope, stop the bleed fast as possible, even if it means taking out the spleen entirely, which is way quicker than trying to repair it right then.
Wow. Big decision, but I get why they do it. So what happens after that initial damage control?
Okay, so once the patient's stable, immediate threat's gone, they're moved to the ICU, right? Give them time to recover some. Then they can go back in, address any remaining issues, make sure their recovery's on track long term. It's not about neglecting those other injuries. It's about being smart, staging those surgeries for the best chance of survival.
That is amazing. It totally changes how I picture the OR. It's way more strategic than I ever realized. But then every case is different, right? SurgiMind mentioned treating different types of patients, like older folks or kids. That's got to have its own challenges. What do they say about that?
Good point. Trauma care, it's not one size fits all.
Yeah.
With older patients, you got to think about they might have other health problems already. Their organs might not work as well. Even their meds can change how they respond to treatment.
So it's not just the injury, it's understanding the whole patient, how their age, their health, all of it plays a role.
Absolutely. And with kids, even more complex. Their bodies react so differently to trauma than adults do. Like they've got less blood, so they go into shock much faster. You need the right size equipment, right dosages, even how you talk to them throughout it all. It's got to be different. And of course, you can't forget the psychological impact on them either.
Wow, so much to consider in those moments. That's where the teamwork aspect has to be crucial, right?
100%. SurgiMind was very clear about this. Even the best surgeon in the world, they can't handle a trauma case alone. It takes that whole coordinated team. The paramedics first on the scene, ER nurses, anesthesiologists, everyone.
It's that image of a well-oiled machine, everyone moving in sync.
Exactly. And that doesn't just happen, right? Clear communication is key. Everyone knows their role, anticipates what others need, adapts on the fly.
You know, that resonates even outside the ER. I bet a lot of our listeners can relate to that. Needing teamwork, clear communication when things get crazy in their own jobs, or even just dealing with, like, a chaotic family dinner, right?
For sure. Staying calm, communicating well, relying on those around you, those are good skills to have anywhere. But going back to the medical side, SurgiMind brought up something else I found really interesting. Simulation training.
Oh, you mean like those super lifelike mannequins they use in med schools? I've seen those on TV. They even bleed and breathe like a real person.
Exactly. And the experts on SurgiMind, they said simulation isn't just a bonus anymore. It's becoming essential.
Makes sense. You can't exactly recreate that intensity, the unpredictability of a real trauma just by reading a textbook.
Right. Simulations let medical folks at all levels practice their skills, make decisions under pressure, really fine-tune how they work as a team, and all in a safe space where it's okay to make mistakes and learn from them.
It's like a safety net while they're learning to deal with these situations that are so complex, so often life or death. And like we've been talking about, in trauma, being prepared for anything, that's everything.
Absolutely. And that's another thing SurgiMind really emphasized, this field trauma care. It never sits still. New tech, new ways of doing things, even new ways of thinking about trauma itself, they're always coming out.
It's like the learning never ends.
You got it. And that dedication to constantly improving, that's what ultimately leads to better outcomes for patients.
Well said. So we've covered a lot. That ABCDE approach, damage control surgery, how you treat different patients differently, how vital teamwork is, and how simulation is changing the game. Seems like trauma surgery needs more than just technical skill. You need to be adaptable, think fast, always be learning.
It's this amazing mix of high tech and, good old-fashioned human ingenuity.
Mm-hmm.
And while we've covered a lot, it's really just a glimpse into this world, how complex it is, how much it's changing all the time.
Totally. So as we head into the last part of our deep dive, I'm curious about the future of it all. What new technology is coming down the pipeline, and how might it transform how we approach trauma care?
Well, SurgiMind pointed to some seriously futuristic stuff, things that almost sound like they're straight out of sci-fi, honestly. One that really stuck with me was this idea of augmented reality, right there in the OR.
Augmented reality during surgery. Okay, walk me through that one. How would that even look?
So picture this, a surgeon, they've got these special glasses on, and it's
Yeah.
overlaying crucial info right onto what they're seeing. Vital signs, maybe even a 3D model of the patient's insides built from their scans, or even real-time guidance during a really complex procedure.
That is wild, like giving surgeons X-ray vision, basically. Anything else on the horizon, something to shave even more time off those crucial decisions.
Oh, yeah. They talked about artificial intelligence, too, AI playing a bigger role, especially this thing called predictive analytics.
Predictive analytics. Okay, now that sounds really futuristic. So we're talking computers predicting complications before they even happen.
That's the goal. It's all about analyzing huge amounts of data, right? Patient history, their vitals, even their genes. And these AI programs, they'd be looking for those tiny patterns, those red flags, things that even the best doctor might miss. Like, imagine an early warning system that pops up and says, hold on this patient, higher risk of this particular complication.
Yeah.
That they can get ahead of it.
Wow, that's like, what is it, having a crystal ball in the OR? Except instead of telling the future, it's helping those trauma patients beat the odds. Sounds like the future of this whole field. It's going to be this wild mix of human skill and crazy advanced tech, huh?
Exactly. Though as cool as all that sounds, got to remember, tech on its own, it ain't a magic wand.
Yeah.
Like SurgiMind said, even the fanciest tools, they're only as good as the person using them.
Right, of course. No matter how high-tech it gets, it comes back to the doctors, the nurses, their skill, their dedication, all of that.
Couldn't agree more.
Well, this has been incredible, really eye-opening. From that ABCDE thing all the way to augmented reality and AI, talk about a whole new appreciation for what goes into trauma care,
Yeah, it's pretty amazing. Good reminder that behind those serious faces, those rushing doctors and nurses, there's this whole other level of knowledge and dedication that most of us, we just don't see.
For sure. So next time anyone runs into, I don't know, their doctor, even a trauma surgeon, Take a second and think about all that goes into it, the difference they make in people's lives. It's pretty incredible.
Absolutely. They're the real heroes.
On that note, I think we'll wrap up our deep dive into the incredible world of trauma surgery. Hope everyone found it as fascinating as we did. Until next time, keep those brains working. And remember, knowledge, it's a journey. Best traveled with curiosity, an open mind, and yeah, maybe a little awe for what humans can do when we really put our minds to it.